Assessing someone with SCI for strength training. It's a complicated question, and I can share how I would do something like that. Part of my philosophy is that, we focus on helping people to stick to their program. So first I'll usually start with some different types of assessment to get a sense for, how strong is the individual. And then as you're designing the program, it's a lot of monitoring, trial and error, and follow-up. So start slow, make sure that technique, we're doing a really good job with technique before we start increasing those weights and then working our way up.
So with cardiovascular fitness, most people with spinal cord injuries have a lower heart rate and blood pressure than normal. Because of that, heart rate and blood pressure is not a great measure for them. So how do you prescribe or determine what's a good level of exercise? And what we've found, and there's been lots of research, is the rate of perceived exertion, which is a scale. It's easy to use in the clinical setting.
So for example, you have them do 10 repetitions of an exercise and say, okay, on a scale of 1 to 10, how hard was that? 10 being the heaviest thing you've ever lifted, 1 being light as a feather, how hard are you working? We're looking for maybe around 5 to 6.
Some of the problem that can happen with people is they will start exercising and they may start to feel nauseated, they may feel like they're going to pass out. And that's a very common response. It's called exertional or exercise-induced hypotension. And it is common and it can be overcome. But what you have to do is do a discontinuous approach to exercise, where they'll do 2 or 3 minutes, then take a break, and slowly increase the length of time that they're exercising. And generally, we would recommend that people get up to the 20 to 30 minutes of aerobic exercise continuously before they start increasing the workload. That is the most important thing, and most people with SCI can improve that. They just have to take a discontinuous approach rather than a continuous approach.
Other important aspects are muscle compensations. They can come from things, for example, perhaps certain muscles are inactive, some may be weaker than others, or it can even be in instances where someone might have spasticity. So you might do an alternative movement to make up for that muscle inactivity or imbalance there.
It can be difficult to assess and qualify, design an appropriate program for someone with SCI. So you need a lot of adaptations or accessories to help them be safe or balanced. Exercise is most definitely encouraged for everyone with a spinal cord injury, and the benefits are documented and well indicated, but it is good to always, when you're changing your activity levels, to get medical clearance or talk to health professionals about it.
And when you're selecting those activities, you want to ask, what's the goal? So if we can link what their goals are, their motivators for wanting to be physically active or programming, it creates more meaning, and perhaps hopefully that you're more likely to stick to it.